How do doctors identify worrisome pancreatic cyst features? Imagine finding a small bump on your pancreas during an imaging scan. Doctors don't jump to conclusions but carefully look for signs that might suggest something more serious. They evaluate a combination of imaging results, symptoms, and lab tests to decide if a cyst needs closer attention. One key feature they check is the size of the cyst. If it's 3 centimeters or larger, that raises concern because bigger cysts are more likely to be precancerous or cancerous. They also look at the pancreatic duct, which carries digestive juices. If this duct is dilated between 5 and 9 millimeters, it's a warning sign. If it's 10 millimeters or more, that's considered a high-risk feature indicating a greater chance of malignancy. Doctors also pay attention to the internal structure of the cyst. The presence of mural nodules or solid parts inside the cyst, especially if they are 5 millimeters or larger, can be a red flag. These nodules may enhance with contrast imaging, which suggests abnormal tissue growth. Thickened or enhanced cyst walls can also point to inflammation or early neoplastic changes. Another important sign is a sudden change in the pancreatic duct's size, especially if it narrows sharply while the pancreas downstream shows signs of atrophy or shrinking. This pattern can be linked to obstructive processes that raise concern. Symptoms and lab results add more clues. For example, if someone develops jaundice, which causes yellowing of the skin and eyes, especially if it's caused by a cyst in the head of the pancreas, that's worrisome. Recurrent pancreatitis or inflammation of the pancreas, linked to the cyst, also raises concern. Blood tests measuring tumor markers like carbohydrate antigen 19-9 can be elevated in pancreatic cancer. New or worsening diabetes can sometimes be a sign that the pancreas is affected by abnormal growth. If fluid from the cyst is sampled and shows high-grade dysplasia or cancer cells, that's a clear warning. Rapid growth of the cyst, more than 5 millimeters over 2 years, is another red flag. When these features are identified, doctors often recommend further tests like endoscopic ultrasound combined with fine needle aspiration. This procedure allows them to get cyst fluid for detailed analysis, including looking for cancer markers or abnormal cells, helping them distinguish benign cysts from those that need urgent attention. Guidelines like the Fukuoka criteria help doctors categorize cysts into low, worrisome, or high risk. This helps determine whether to monitor the cyst more closely or consider surgery. In essence, doctors use a careful combination of imaging, symptoms, and lab data to spot features that could indicate a higher chance of pancreatic cancer. Always remember, if you have concerns about pancreatic cysts, consult a healthcare professional for personalized advice and appropriate testing.